Welcome to week 12. The topic is behavioral and cognitive theory and practice. The class is SWK 700, Human Behavior and the Social Environment. I'm your professor, Dr. Yvonne Ruiz. The material on this screencast is mostly from Malcolm Payne's Modern Social Work Theory. So let's begin. My first point is that CBT connects very well with neuroscience. We talked about neuroscience and neurobiology last week, and the subject matter and the science base of neuroscience connects with CBT. And as you know, as we talked about, neuroscience is an increasing influence on how we practice social work and the knowledge base of our profession. Just to review, neuroscience examines how the brain processes learning, perceptions, cognitions about the world. So it provides evidence about how people's thinking interacts with their behavior, and I would include their emotions. And cognition, behavior, and emotions is what CBT is all about. So here is a visual depiction of the CBT triangle of thought or cognition, of emotions, and our behavior or our actions. So the idea is that what we think affects how we act and how we feel. So the cognitive element of CBT practice focuses on addressing problems or dysfunction in how people's thinking directs their behavior or affects their behavior and impacts on their emotions. The behavioral part of CBT practice focuses on defining and addressing people's unwanted problem behaviors. So the idea is that what we do, how we behave, affects how we think and how we feel. Then the third leg of the triangle is our emotions. That what we feel affects how we think and what we do. And if you think about the impact of mood on thinking and behavior, you can see that emotions, cognitions, and behaviors are very much interconnected. I want to make a point here about the distinction between CBT as a theory and CBT as a therapy or as a way of practice. So as a theory, CBT is influenced through 4 different types of psychological theories. And then CBT as a practice is a very clearly defined practice model that uses particular sequences to affect and change thinking and behavior and emotions. So let's just talk about the theory for right now. So the first stream of influence are the psychological learning theories. An example of psychological learning theory is information processing, which looks at how we take in information, some type of stimuli that comes from the environment or comes from another person or comes from our own activity, how we process that stimuli in our own mind, and then what is the output that's associated with the input, the processing, and then what we do or how we think. So that's just a very simple model of information processing. But psychological learning theories, there are a group of them, and all of them focus our behavior on observable behavior, what we can see. They analyze external factors that are involved in learning, and examine how cognition and emotions are mediated and how they mediate behavior. And then they seek to explain human interactions in terms of what are the rewards and benefits of our thinking, our behavior. What is the payoff, in other words? The second theory that influences CBT is Albert Bandura's social learning theory. SLT is one of the most influential theories of learning and also about human development. It is rooted in basic concepts of traditional learning and how we take in information and how we process it. But the difference is that the focus is on how we learn from our social context and also from the people and relationships, and how we as individuals learn from each other. So this is what Albert Bandura's main contribution was, thinking about how we learn new information, how we practice new behaviors through observation and observing other people, as well as how we imitate what others do and what we see. Think about children imitating what they see on television. And then the other piece of learning is role modeling, how that's very important in setting examples for how we behave, what we do, and how we think. So the methods of social learning are observation, imitation, and role modeling. And SLT has had a big influence on social work. First, it's a very accessible theory. It makes a lot of sense, especially when you think about how children learn and internalize their attitudes, their perceptions, their behavior from environmental influences. The third stream of influence is behaviorism. You may have heard of Pavlov's dogs, if you remember. Pavlov rang a bell, and the dogs associated the bell ringing with being fed. So they began to salivate as soon as they heard the bell because of the association between the bell and being fed. Other theorists were Skinner and Watson. So behaviorism is an approach based on learning theory, again, that aims to treat dysfunction or unwanted behaviors through very specific techniques that are designed to reinforce those behaviors that are wanted or that are desired, and to extinguish or eliminate those behaviors that don't work or that cause pain or cause bad things to happen. The focus is on identifying very specific behaviors, and these are the behaviors that clients feel anxious about, or that they worry about, or that cause them pain. So the idea is that if we change those behaviors, then we can have a much better outcome. And thus, the anxiety, the pain, and the worry is also eliminated. So we as practitioners, working from this approach, need to use our own observation skills and our own clinical judgment to make a clear analysis and have a clear description of the problems that our client is dealing with. So we need to use our skills and our methods of assessment, intervention, and evaluation are very explicitly defined from this approach. The way that we practice is broken down into very specific components, and how we apply our interventions to clients is also very specific. Another feature of behaviorism is that progress is monitored using objective measures and by comparing data from the past to the present. What that means is that you compare data from what was happening with the client before the intervention, and then you compare it to what's happening after the intervention to see how effective the intervention has been. I'm just going to put my own thoughts about behaviorism out there. I'm not drawn to behaviorism as a psychotherapy because it is very mechanical, very mechanistic, and doesn't always take into account some of the more nuances about the social context of the client. But behaviorism aims to change and shape our client's behavior in more positive ways that can result in better outcomes. So the major concepts that are associated with behaviorism are depicted on this slide. So I want to begin by saying that conditioned behaviors are types of associative learning where a stimulus becomes associated with a consequence. So conditioning, or also called classical conditioning, is a process that involves creating an association between a neutral stimulus and a pattern of behavior. So the idea is that a specific behavioral consequence results from particular associations that is made between a stimulus and a behavior. Or as the slide says, conditioning is a process of developing patterns of behavior through responses to environmental stimuli, and they result in specific behavioral consequences. Another type of conditioning is operant conditioning, and this focuses on using either reinforcement or punishment to either increase or decrease a behavior. And through this process, an association is formed between the behavior and the consequences of behavior. So the idea in operant conditioning is that the behavior is strengthened or weakened by associating a specific behavioral response with either a reward or a consequence. So both of these are types of conditioning. The difference is that operant conditioning accounts for the association with a reward or a consequence, whereas conditioning looks at the pattern of behavior through a variety of responses that can happen to environmental stimuli. The third concept is positive reinforcement, and positive reinforcement encourages behavior through the use of a reward. This means that giving something to the subject or the individual, the client, when they perform the desired action, associates the action with the reward, therefore they continue that behavior or they do it more often. The reward serves as a reinforcement or a reinforcing stimulus. A simple example of positive reinforcement is when you give a child some type of treat that encourages the child to complete their chore, such as cleaning up their room. And giving them a treat works better than nagging or scolding. Negative reinforcement is a process by which an aversive or undesired event is terminated or extinguished by the individual's behavior. So an example of this is allowing your child playtime or a favorite TV show or play on the computer when your child behaves well and does what he or she is directed to do. Another example of negative reinforcement is removing a curfew when your teenager shows that they have the responsibility to use their time well. The idea is that an aversive stimulus is removed after a desired behavior is exhibited. So negative reinforcement is not a punishment. Rather, you are increasing a positive behavior in contrast to punishment where you are decreasing a behavior. It can be a little bit complex. I hope this slide is clear. So it's important to look at the assumptions of behaviorism. Here the focus is on how behavior is influenced by the environment. So again, our behavior is shaped by what happens to us and stimuli that is occurring in the environment that we are taking in or that we're experiencing. The conditions of the environment are the primary determinants of both animal and human behavior. So the emphasis of behaviorism is on what's happening to us and how it's shaping us. Systematic observation and experimental techniques, meaning scientific experiment, are the best way to understand behavior environment relationships. So this reinforces the idea that behaviorism is very rigid and needs to be followed very closely in how it's practiced. And human behaviors can be modified. We can change our behaviors. This is the hopeful aspect of behaviorism, by the manipulation of the behavior in the environment and by modifying stimuli that is impacting upon us. And finally, individual personality is the sum of acquired behaviors and learned behaviors. And here is where I question behaviorism, because especially from our social work perspective, we look at the acquisition of values, we look at so many other factors in addition to behavior. This is why I was saying that my sense is behaviorism is so mechanical, or the term is mechanistic, rather than organismic, rather than organic. I don't believe that we can just be the sum of our behaviors. I think there's so much more to us. Think of what we've talked about in terms of humanistic theory, in terms of spirituality, in terms of narrative, how we make up stories and how we make meaning of what happens to us. So it's not only the behavior, but it's how we internalize and the meaning that we make of the behavior. This is my perspective. Behaviorism is used, especially with children with developmental needs. Often systems of rewards and punishments can be very effective, as well as with trying to acquire or break habits. You want to break down the behaviors in order to make a change. So I do recognize that behaviorism has its positive aspects. I also just need to think about it in terms of more nuanced and taking into account more contextual factors. The fourth influence on CBT is cognitive theory, which includes cognitive development. So cognitive theory is a learning theory that attempts to explain human behavior by understanding our thought processes, understanding our cognitions. And the focus is on people's attitudes, people's perceptions, people's learning, as well as the emotions and feelings that are associated with that. But the focus is on rational thinking and overcoming negative thoughts and negative emotions. And cognitive theories also include humanistic theory because it's really about our human potential and our ability to think on higher levels. One of the important concepts of cognitive theories is that of mental schema. And a mental schema is another word for a pattern of thought or a pattern of behavior that organizes categories of information and the relationships among what it is that we're experiencing. So we as individuals use mental schemas to organize our knowledge and to acquire new information. And these schemas provide a framework for understanding what's happening to us and what's happening around us. And I think of a mental schema as a file folder. And what happens in our acquiring knowledge is that we break down information into a whole bunch of files, and we're able to call upon the information that we've stored in our memory in order to make meaning and understand what happens to us. So mental schemas represent the ways in which characteristics of events or experiences or objects are recalled and the way that we make meaning of them, as well as how we gain and acquire more information. And schemas develop along with our ability for higher level mental processes. So if you remember from last week's neuroscience, I talked about how the brain develops in a series of steps. And the highest step was the neocortex. And that's where the development of higher order thinking, our ability to make meaning, our ability to use abstract thinking, our ability to make connections among ideas and concepts, our ability to use our judgment to make decisions, to plan and set goals. All of these are examples of higher order thinking. And cognitive theory looks at the development of these processes with a focus on improving the way we think, improving the ability of those processes to make our lives better and result in positive outcomes. So to further break down our higher order thinking skills, there are 4 factors or 4 features of these types of thinking skills. One I just talked about, mental representation or schemas. They're also referred to as mindsets or mental models. The second one is how we process information, and this is related to the information processing model that I referenced earlier. And it takes into account our abilities to pay attention, how we perceive the information that we're taking in, and how we evaluate that information in terms of thinking, how useful is it? Is it valuable? How can we use that information? And what we need to know about that. And then cognitive consistency. Is that information, does it relate to what we already know? Is it consistent with our mental schema? The third one is how we make decisions, identifying our biases and identifying how we're able to think logically and clearly. And then finally, social cognition and social emotional intelligence, taking into account our interactions with others and our relationships. What is our emotional intelligence, our capacity for empathy, how we make categorization based on social information, and attribution, how we decide and attribute particular characteristics to what it is we take in and what we think about, as well as attributes and characteristics of other people we encounter. So these are 4 factors of thinking skills. All of these together need to be interconnected because each of these individually is going to have an impact on our overall cognitive functioning. So this slide represents errors in cognitive thinking that we often see as social workers. This slide presents the 10 most common cognitive distortions. The definition of cognitive distortions is an exaggerated or irrational thought pattern that results in some type of dysfunction or some type of psychopathology. And the psychiatrist Aaron Beck identified and laid the groundwork for identifying cognitive distortions and their impact on human development and human functioning. So there are many of them. There are certainly more than 10, but these are the most common. Number 1 is all or nothing thinking. This is where everything is black and white, and you can't think of anything in between. You either win or you lose. There's no gray area. The second is overgeneralization. An example of this is where you make a mistake and then you overgeneralize. I always make a mistake. So you don't take into account when you do things well or where you are being effective, but rather you're overgeneralizing and making everything seem as if it's only one way. The third is mental filter. This is where we're selective in how we take in information. So mental filter is about not seeing the whole picture, but only seeing certain components or certain parts of it and not understanding the whole. The fourth is emotional reasoning, where you are overemphasizing your emotional responses and not using your critical thinking skills to think about a situation. So everything is colored or everything is slanted based on your mood or how you feel. The fifth is disqualifying the positive. That's where you just don't see positive aspects. So a good example is right now during the pandemic. The pandemic is a huge factor in how we're living our lives right now and how we're able to function. So disqualifying the positive in this current environment would be that you're just thinking about what you can't do and the way your life is limited and the negative impact of the pandemic and not taking into account what is still good and positive about your life. The sixth distortion is jumping to conclusions. That's where you overreact. You make snap judgments without taking into account all of the information. Sometimes we do this when we just focus on first impressions or we don't go deeper into thinking about a particular situation. The next distortion are the processes of magnification and minimization. So magnification, we overemphasize or overblow particular factors or particular aspects so that your perspective is skewed in one way. And minimization is when we minimize other aspects. So an example is we might minimize the risk of particular behaviors. We don't take into account all the possible consequences. Magnification is when we're only focusing on something. For example, we meet someone and we just focus on their positive qualities without taking into account that every person is a mix of both strengths and weaknesses. So when we're magnifying something that's positive, we may feel completely devastated when something that is not so positive needs to be taken into account. The next distortion is personalization and blame. That's when you blame other people instead of taking responsibility for a particular action, or you externalize and you look at other people or other factors instead of balancing it out with what actions did you take. And personalization is when something happens and you take it very personally, that it's something you did or something that you were to blame for. The next distortion is labeling. That's closely related to the process of stigmatizing something or someone else by naming something without taking into account someone's humanity, or without taking into account other aspects of what's happening or other aspects of the person. You just label something and you see it through a one-dimensional lens. And then there are the should statements. And sometimes this is coulda, shoulda, woulda, when you are second guessing yourself, or you're remorseful, or you're falling into regret, thinking about the way something should be or what should happen. And this holds you back from actually seeing the reality of what you can do or taking action to change something. You don't see your sense of agency in this. And sometimes we call this shoulding all over ourselves rather than seeing things clearly. We fall into a fixation or a trap where we are thinking about the way we want something to be, rather than the way something is. There are other types of cognitive distortions that have been identified as well, but these are very common ones that we see. And I will also say that we also fall into cognitive distortions. So even though they're seen as a dysfunction or a psychopathology, these are very common errors in thinking. The more we're able to use our higher order levels of thinking, the more self-awareness we have, the more we're able to engage in reflection that counteracts the effects of cognitive distortions. People usually fall into cognitive distortions when their thinking processes are shallow and not very well developed. An example of cognitive theory is the model of cognitive restructuring, also called reframing. This is a behavioral technique that's associated with CBT. And cognitive restructuring happens when you identify or recognize irrational thoughts or dysfunctional thoughts, and you learn to replace them with more rational or positive thoughts. And this is not a one-off. This needs to be made into a pattern where you practice this and you reinforce cognitive restructuring. So maybe you want to replace your negative thought that I can't do anything right with the more positive thought that you're a competent person and that you're capable. So you need to use self-talk to talk yourself out of the negative pattern and reinforce and replace those negative thoughts with the positive one, that you are a competent person. You need to identify when you're doing things well and when you're behaving competently, and acknowledge that to yourself and validate yourself on consistent basis. So CBT therapists use homework and other tools to reinforce and mold one's thinking patterns. And this is cognitive restructuring. So we just reviewed the 4 psychological theories that contribute to CBT. Psychological learning theories, social learning theory, behaviorism, and cognitive theory or cognitive development. So now we get to practice ideas. Some of this is based on the previous slides. Behavior therapy, focus on changing behaviors. Cognitive therapy, focus on changing dysfunctional thinking, processes, and patterns. And both of those together are cognitive behavioral therapy, which looks at thinking, behaviors, and emotions that generate particular patterns in how we live our lives. Social learning. An example of CBT is assertiveness training, which helps people to practice behaviors and reinforce those behaviors that help one feel more confident, that raise one's level of self-esteem. Role modeling is a form of social learning where clients and people can understand and copy useful and effective behaviors from others. Examples. And mindfulness techniques focus on paying attention to important issues in our lives, and not only important issues, but that focus of paying attention on our own thinking processes and how they shape our behavior and emotions. These practice ideas come directly from the pain chapter. So from this practice perspective, CBT methods are very clear and specific procedures which focus on changing thoughts, feelings, and behaviors. And these techniques focus on helping clients learn new skills to change or modify how we function and to reframe or alter cognitive perceptions. The interventions are designed to solve problems, and they're very action-oriented. They're very oriented in making a change in the present. They don't go back and review what happened in childhood, but they're very practical and concrete. And your role as a social worker therapist is that of a teacher, a trainer, I would include a coach, and a change facilitator. So being very active and being very directive is part of the CBT role. So the change process occurs through very clear and specific intention, includes cognitive reflection, in which one identifies, challenges, and changes thinking errors, misconceptions, faulty belief systems, cognitive distortions, illogical thoughts, in order to change emotions and then leading to a desired behavioral change. And I like this quote from Norman Vincent Peale: "Change your thoughts and you can change your world." Again, very optimistic, very hopeful way of practicing. Here are some examples of CBT interventions. So in terms of the goal of improving cognitive capacity, some of what you might do is increase knowledge about how relationships function in order to make relationships more gratifying and satisfying. Enhance your skills at perceiving what is happening around you. Improve decision-making skills and improve assessment, or judgment skills. In terms of behavioral skills, thinking about self-presentation, that's how do you want to behave with others? How do you want to present yourself? This is directly connected to confidence building and self-esteem. Social initiatives, how do you want to promote social interaction, conversation, engaging in communication and improving communication skills, improving relationship skills, and how do you maintain positive, fulfilling relationships over time. And conflict resolution skills. How do you solve problems? How do you mediate between people to create situations where both people can feel good and avoid that all or nothing thinking? So CBT interventions are used in assertiveness training, anger management, social skills training, where you might rehearse particular behaviors. They're also useful in parent training. These are some examples. The benefits of CBT are the strong focus on outcomes, that it is an evidence-based practice. Many of the practice models are empirically supported, and CBT has one of the best and most well-developed evidence base for effectiveness. Many interventions are manualized, so they can be replicated again and again. There is a lot of evidence that it is effective for many mental health disorders such as depression, anxiety, phobias, and PTSD. And CBT has been applied in diverse settings with diverse populations. I would also include the benefit of CBT, that it is one that insurance companies look to, and in integrating CBT practice into your treatment plans ensures that the number of sessions will be approved, and that you can discuss and present your work in ways that are going to be seen and approved by maybe your supervisors as well as insurance companies. And we also need to look at some of the critiques and limitations of CBT. I've already talked about that it can be a little bit mechanical. I'm also going to add that CBT focuses on problems and deficits. By its very nature, you're looking at changing dysfunction, and many times CBT is a brief or short-term therapy, so there's not a lot of time to also balance out your work with looking at strengths and looking at other aspects of the social environment. It's also very focused on the individual, and sometimes the focus on problem solving emphasizes that problems stem from within the individual and their thought patterns and behavior and emotional patterns, thus ignoring the impact of social context and the effects of mental health disorders such as depression on other aspects of the environment. CBT is very technical. There's a lot of jargon. There is, a very particular vocabulary that's associated with CBT. Some of the procedures are very formal and may require a high level of training and supervision in order to implement CBT well. There are a lot of practitioners who implement parts of CBT with varying levels of effectiveness, and may not always acknowledge or know that the way they're practicing may not actually be effective. So this is the last slide of this screencast on CBT. We will continue our discussion in our Zoom time, and I want to thank you for listening this far.